Good afternoon, ladies and gentlemen. Welcome to the final session in the auditorium. Can I ask you all to make sure that your mobile phones are off? And the exits are all clearly marked, should there be any reason for you to leave quickly, so be aware of that. It's a great privilege to chair this session, and I'd like to introduce our keynote speaker, who is Dr. David Graham, who's in charge of the Animal Health Ireland programmes. I've known David for a long number of years because he has had a distinguished career in virology, doing work on BVD, bovine respiratory disease, and IBR. So, David, if you can come up to the stage. You have the floor for 40 minutes.
Okay, well, thank you, George, for those words of introduction. Good afternoon, ladies and gentlemen. Thanks to the organisers of the conference for giving me this opportunity to tell you something about national cattle health programmes and to give you an Irish perspective on those, and in particular then to say something about the role of Animal Health Ireland in the delivery of those. The majority of the talk will address the various programmes that Animal Health Ireland are involved in delivering, but before I go on to give you at least an overview of those, I'll take a few minutes just to tell you something about, I suppose, the strategic context in which the organisation works, with some background around the Irish agri-food sector, and then a few slides giving you some information, some background on the organisation itself. So in terms of strategic background, the Irish agri-food sector, it is a significant contributor to the Irish economy overall. So as you can see there, a value of €26 billion in 2015, responsible for some 8% of employment, and by far and away the largest sector within agri-food is the cattle sector, both dairy and beef. In those sectors and in others, we are multiple times self-sufficient, and therefore the export markets are particularly important to the industry. And you can see there again that the sector makes a significant contribution to the totality of Irish exports, accounting for some 13%, with a value last year of some €10.8 billion, so a significant contributor. And the other important point to note there perhaps is the increase in the value of exports over the past 5 to 6 years, so almost increasing by 50%, and that against a background of very difficult economic conditions when certainly no other sectors in the Irish economy were delivering that type of performance. In terms of the cattle sector itself, we have a national cattle herd, or breeding herd at least, of just over 6 million, so just about enough for one cow for everybody in the country. We have those cattle are distributed across approximately 116,000 herds, of which 17,000 are dairy herds, another 61,000 what we refer to as suckler herds, so beef breeding herds, and the others then being non-breeding herds. In terms of our annual calf crop, we have in the region of 2.3 million calves per annum being born. And as you're probably aware, we have a very strong emphasis on grass-based production in Ireland, and for that reason the majority of our calves are born in the spring to match the grass growth cycle. And as you can see from the figure there, at peak, week 7, week 8 of the year, we have somewhere around 140,000 to 150,000 calves being born, and at the lowest point perhaps a tenfold lower rate of registration, so very significant fluctuation, and that obviously feeds into some elements of our programmes, and particularly in terms of tag testing for BVD and the requirements that places on testing laboratories. Over the past 5 to 10 years, we've seen the introduction or the publication of two key policy documents which have really set out a range of goals for the sector. The first of these is the Food Harvest 2020 document, which sets out some overarching goals for the agri-food sector, but which also then delivers a number of sectoral targets, either based on value or based on volume. And the two key ones for the cattle sector are listed here. So a 40% increase in the value of beef outputs, and on the dairy side then a 50% increase in milk production across the decade. And that last one in particular obviously really been built around the lifting of production quotas in Ireland and across the EU in 2015. And you can see the impact of that last year there with a 13% increase in the volume of production in that year alone. And certainly, albeit with fluctuations in commodity prices, I think the sectors are on target to deliver to those goals. More recently, last year, we saw the publication of another 10-year strategy document, Foodwise 2025. So that takes us through from 15, obviously, to 2025. And that, again, sets down some ambitious targets. So an increase in gross value added for the sector of some 70%, an increase in the value of exports of 85%. And within the document, then, it identifies a number of key areas that will need investment and development in order to see these targets realised. And I suppose it's fair to say that historically in Ireland, the industry has been well served with information, advice, research on the areas of nutrition, on the areas of breeding, but not so well served centrally in terms of animal health around endemic diseases. And that really is the strategic context against which Animal Health Ireland was created and in which it works. And hopefully you can recognise the opportunity, but also the necessity of improved animal health to deliver on a number of these areas: market development, competitiveness, sustainability, both in terms of economic and environmental sustainability. So if we go on just to say a little bit then about the organisation itself, it was established in 2009. We are a non-profit public-private partnership, and you can see there what we're about. So providing leadership, knowledge, education, coordination, with the focus then on establishing effective control or eradication depending on the particular disease. And then to note, so we deal with non-regulated diseases, at least those that are not regulated internationally. And our broad remit is diseases of livestock, but currently our focus is exclusively on diseases of cattle. And really then about driving improved profitability across the sector due to our consequent on improved animal health. Obviously, even within cattle, there's a very broad range of areas that we could become involved in. So an early activity within the organisation's lifespan was a prioritisation exercise to identify those diseases that we should be focusing on. So early on, as I say, this exercise was undertaken, prioritisation exercise, a Delphi study and a survey of farmers seeking views to assist with that prioritisation exercise of diseases. And really consequent on that exercise then, the diseases that you see listed here were drafted into our 2012 to 14 business plan, our strategic plan for a 3-year plan, and have been carried forward. And indeed Beef Health Check is a new programme in our current 3-year plan that sees us through from last year through to 2017. So these are our core programmes and where the majority of our time and the majority of our budget is invested. And just before I go on to say something more about those, just to note that we also do work in a number of other areas, as you can see listed here. So biosecurity, calf care, parasites, parasite control, and animal health economics. Some of these, it's developing foundational factual resources and the communication around that. A number of these cut across, so biosecurity, for example, cut across a number of our core programs. In terms of the structure of the organisation, we're a relatively small organisation. We currently have, albeit growing but small, we have a current staff of 11. We report to a board. And as you can see then, for each of the core programs and the other work areas as well, an important part of the organisational structure are the technical working groups. For each of these, there's a separate technical working group, or TWG, with an independent chair. And the TWGs then are populated by a range of individuals who give their time to the activity of the particular group. drawn from academia, industry, government, practice, and so on, but with a particular interest and expertise on the given subject. In the first instance, the TWGs are responsible for developing the factual resources, decision support tools, identifying areas that require further R&D, and so on. But as these move toward or become national level programs, the TWGs are ultimately tasked as well then with the development of the program and bringing that forward. The other important group to note on this slide on the right-hand side are the implementation groups. And as each of these moves to become a national program, we have either an implementation or, in the case of CellCheck, an industry consultation group. But these groups are, again, comprise representatives from across our stakeholders. And it's probably important to point out that whilst AHI gives leadership, coordinates activities, ultimately when it comes to taking a decision to implement a program at national level, it's the implementation group or the consultative group that ultimately takes the decision and subsequently gives structure to the development of that. So it is very much industry-led, and whilst AHI chair those, we are not the ultimate decision maker, and that's an important point. So if we go on to say, for the remainder of the talk then, to give you some background and update on the various programs, and as we go through each one, I'll give you the objective for the program in the first instance that is laid down in the strategic plan. So if we start with BVD, and you can see the logos of the various bodies that are represented on the implementation group. But the objective as laid down in the strategic plan then for BVD is eradication from the national herd by the end of 2020. The program began with a pilot, a voluntary year in 2012, and that was a very useful exercise in many ways in that it allowed us to troubleshoot the program, proof of principle to demonstrate it worked, but also for industry to demonstrate commitment and buy-in sufficient for the implementation group to take the decision to go forward to a compulsory program, and also for government to introduce supporting legislation at the request of industry. And these 4 points really summarise how the program works, but also summarise the legislation, and it's very simple and straightforward legislation. So essentially, first of all calves that are born from the start of the compulsory phase, so the 1st of January 2013, must be tagged within 20 days of birth, a sample taken and sent to a designated laboratory. And again, there's a process behind laboratory designation which takes into account accreditation, laboratory turnaround, linkage to the database, and so on. The program allows the option to retest animals if they have an initial positive or inconclusive, so to differentiate between TI and PI animals, transiently and persistently infected, and also addresses movement. So either for animals that have a current positive or inconclusive status and are considered in the context of the program then to be PI, or that have been assigned a suspect status, they are specifically prohibited from movement. But equally, to manage the requirement for all animals born from the start of January 13 to be tested, they must have a negative test result on the database before they can move. Just to give you a brief overview of some of the animal statuses that the program generates. So if we take our calf and cow, the majority of calves will test negative. The calf is assigned a negative status, and that's considered a direct negative in the sense that the animal has actually been sampled and tested. We know from the epidemiology of BVD that if the calf is not PI, the dam cannot be PI, and therefore the dam is assigned an indirect negative, or in database speak, an INDI-neg status. And it also then counts the number of negative calves that a particular dam has produced. So we'll see later an INDI-neg 1, INDI-neg 2, and so on. On the other side, if the calf tests positive or indeed inconclusive, from the program perspective, it's PI until proven otherwise. The dam is then under suspicion, so that's one of our primary suspect statuses, and she's awarded a dam PI status on the database, and that must be clarified typically by testing. And somewhere between 5 to 6% of those animals will in fact test positive, and when that happens, then the database will look to identify any other untested offspring of that particular female that are still alive, either in the same herd or in other herds, and they're then assigned an off-PI status, the offspring of a PI, essentially deemed to be PI as well, and they fall under the suspect status, again then of animals that cannot move. This schematic just gives you an overview of some of the interactions around the database, which is provided to the programme by the Irish Cattle Breeding Federation, or ICBF. And this really is a crucial component of this, and indeed of other programmes as well. So the farmer, and to note that the farmer carries the cost of the testing. The farmer tags the calves, sends them to the laboratory, and on a daily basis, a nightly basis, the laboratory uploads those results to the database. In terms of reporting back to the farmer, as you can see on the left of the screen then, you're right, the database issues those results early the next morning then as a text message to the farmer's mobile phone. In addition, if there are positive or inconclusive results, it also generates a letter which contains details of next steps, further information around the animals, a submission form for follow-up testing if that is required. And in addition, there's an output back to the governmental database, and it is that then that allows that system to manage movements, and specifically to prevent movements either of animals with a positive or suspect status, or that have been born during the lifetime of the programme but don't yet have a valid result. And the other screenshot that you can see there is just to remind me to say that there's been a significant amount of development of resource on the database, both for individual farmer clients and also for veterinary practitioners. So this is what we refer to as the farmer dashboard, and what it's illustrating there is a breakdown of all of a summary breakdown of the herd by the different animal statuses that can be drilled into down to individual animal, and to see records of multiple tests. And a number of investigation tools then have been built around that as well, which can assist particularly for the practitioner looking at either identifying sources of introduction of infection into the herd, or more generally managing the herd within the programme. In terms of progress, so you can see either if we measure that very much at a high level here, but in terms of either herd or animal, so you can see steady progress in each year of the programme from 2013 onwards. So currently, year to date in 2016, 0.15% of calves born this year considered to be PI. And bear in mind that whilst we're only halfway through the year, we are in fact some 80% plus through the calf crop this year. We can look at that as well geographically. So this slide shows the distribution and numbers of PIs born in 2013. And if we bring that forward to the current year again, I think it illustrates quite nicely the progress made to date. Clearly, as we've come through 3 years of compulsory testing, we have at this stage built up on the database results or statuses for almost every animal now in our breeding herds. So you can see that there's just over 1% of animals on the database currently for which we don't have a valid status. That equates to some 80,000 animals. Approximately half of those are calves that have been born in the past weeks and are still going through the testing process. The balance of those are older animals born before 2012, for which we do not have either a direct or an indirect result. And a proportion of those clearly will be bulls, for example, that haven't been sampled. But certainly that's a particular population that we're keen to address and to reduce that number to zero as quickly as possible. As we have accumulated this level of fine detail now on the national herd as well, we're now able to start to move from measuring purely at the individual animal level to aggregate to herd level, and obviously the goal being then to aggregate one further step potentially to national level in terms of freedom. So within the programme and within the database, we can now assign herds to what's referred to as negative herd status, or NHS. And NHS is applied or acquired by a herd when all animals in the herd have a known negative status, be that based on a direct or an indirect result, and also that there have been no PIs in the herd for the preceding 12 months. The 20,000 unknown herds in the unknown category have been BVD free for 12 months plus, but they typically contain 1 or 2 animals of unknown status. So those 40,000 older animals, as we test those or as they go to slaughter, we see this number continue to drop. So just to wrap up on BVD, I think we have made significant progress. We're at the stage currently with revisiting some modelling work that we did last year, really to seek to put in place a roadmap to take us to eradication now and beyond. And that will actually be the focus of our next meeting of the implementation group. Okay, so we move on then to the next programme, Cell Check. And again, just to give you the objective of this programme, so as you can see there, this is addressing somatic cell count. And the goal, again, as established by the industry consultation group, is to have 75% of the milk being supplied by Irish farmers with a cell count below 200,000 by the end of 2020. And essentially then the programme is built around these 5 pillars. So in terms of setting goals, well, that's the figures that I've just quoted. If we consider building capacity, the programme recognises the importance of a multidisciplinary approach, either to training, knowledge transfer, or to addressing individual on-farm problems. So in that context, significant effort has been put in by the programme manager in terms of training of a range of service providers, so veterinary practitioners, milking machine technicians, farm advisors. And those then can form into teams, essentially to amplify the message. So in terms of building awareness, you can see on the image there, that's a cell check workshop. So again, disseminating best practice to farmers. And over the next 18 to 24 months, we expect to see some 7,000 farmers go through a cell check workshop within the knowledge transfer programme that's currently rolling out in the current phase of the Rural Development Programme here in Ireland. A number of other measures as well, clearly an ongoing and consistent communication plan, monthly cell check tips even, videos on milking technique, stakeholder communications, conference presentations, but seeking to present a consistent message that flows through the milk production cycle each year, as well as seeking to drive improvement, also to award those who have already achieved excellence, and we do that through a Cell Check award programme, which brings together the top 500 producers in the country for an award ceremony. Another important aspect of building awareness is the economic impact of elevated somatic cell counts. And without going into detail in this particular slide, it just illustrates or summarises some work that was carried out by Teagasc, the Irish Agriculture and Food Development Authority. And really the bottom line from this work was that by reducing cell count to and maintaining it at an achievable level, that there can be an overall gain in net profitability of at least 1 cent per litre, so a clear economic driver for improvement. Another pillar was establishing best practice, and that really is distilled into this fairly heavy, fairly large book, so the farm guidelines, the Cell Check farm guidelines. And as you see again, this really distills best practice developed in collaboration or building on work that was carried out by Animal Health Australia. But this really is the manual then that informs the information that's communicated in the service provider training, in the farmer workshops, and so on. So in terms of evaluating change, the other pillar, and this can be for all of these programs, can be an important challenge in terms of actually accessing data that can be used to measure progress or measure performance. So in the first instance, we were able to access information from milk recording herds, and that's summarised in this particular figure. So you can see the green line is the percentage of herds with a somatic cell count, an annual count below the 200,000. And the key point perhaps to note is that from 2010 onwards, when the programme was initiated, we have seen year on year a steady improvement. So some 26% of herds in 2010, 53% in 2014, and then a particular concern perhaps with expansion in 2015 that things might might come to a halt or even go backward. But we're particularly encouraged to see that continuing trend of improvement with 61% of our milk recording herds reaching that goal last year. And then as the programme has been developing, we have been working closely with the Department of Agriculture and also with the processors to build a national cell count database based on bulk tank, in recognition obviously that not all herds are milk recording. Currently that's populated by data for 2013 and 14. Shortly 2015 will be added, and then after that it will be a matter of backfilling back to the start of the decade or possibly before. But again, whether we measure at herd level or in terms of volume, again, when we go to the national herd, we see evidence of continued improvement. So the next programme I will give you some background on then is Johne's disease. And again, to give you the objective from the strategic plan. So it is laid down there to establish a voluntary national programme for Johne's disease. And essentially this has got two complementary objectives within it, one of which operates at farm level, the other operates really at national level. At farm level then, to enable participating herd owners to have increased confidence in the absence of infection or to achieve significant control or elimination where present. Generally, we feel that the situation with Johne's is somewhat better in Ireland than it is elsewhere, and hopefully at least one of the figures will lend some support to that as we go through. So we believe we have a significant proportion of herds that remain free of infection. So our goal in those herds in particular, the focus is on bio-exclusion and seeking to keep them free. Equally, for those herds that are infected, the primary focus is on biocontainment and seeking to manage infection downward within those herds. And then at national level is really about underpinning the quality of produce in the marketplace. So that's the overall objective. In 2013 and into 2014, we established a pilot programme focusing on dairy herds, and that programme has been running since then. So we've had 3 years of that pilot. And essentially, three key components for herds that sign up to participate in that programme. The first of those is the conduct of a veterinary on-farm risk assessment and management plan, or VRAMP, as it's generally known. And this focuses in particular on within-herd transmission pathways. So it's a detailed scoring of each of the production stages, from the calving pen to calf rearing, through to in-calf female and back to dry stock and into the calving pen. So scoring all of those, going through all of those, providing an opportunity for detailed discussion with the farmer. These are delivered by what's referred to as an AVP, an approved veterinary practitioner, and that essentially indicates that they have been through a process of training with Animal Health Ireland and how to specifically how to deliver the VRAMP, but more broadly in terms of the structure of the programme. In addition to the opportunity that gives for farmer and practitioner to have an in-depth conversation as the VRAMP is conducted and to discuss test results and so on, a key output then is the agreement of up to 3 farm-specific recommendations based on the particular findings for that VRAMP. With those being prioritised to address those that will drive the greatest improvement in or reduction in opportunity for within-herd transmission. The other 2 components then of the programme, firstly, as you would anticipate, is testing, again through designated laboratories, accredited tests, and those results, and indeed the results of the VRAMPs, coming back to the ICBF database. And again, that allowing us, as we'll see, to build up a significant amount of information for analysis and to plough back into the programme again. Primarily serology and more limited use of pathogen detection, initially just on culture, but more recently also bringing in PCR. And then the third component, which is really just being introduced now at the end of the pilot, is herd categorisation. And this really seeks to provide an independent, objective measure of confidence of freedom of infection in participating herds. And that takes two things into account. Firstly, test results. So herds that have got negative test results. The second factor that it brings in then is their purchase history. So a herd that may have negative test results but has had a history of purchase intuitively has a lower probability of being truly free of infection than an equivalent herd that has been closed over that period. And the categorization process for test negative herd essentially ranks them equally for herds that are positive. It ranks them according to the perceived level of infection in those herds. So where are we with the program in terms of the pilot? So we currently have 1,300 herds participating in that, and as you say, a significant amount of information having come back to the database from these herds now. So somewhere over 2,600 VRAMPs are now loaded, and that gives us a lot of information where we can now start to go back and actually analyse those to see do they actually translate into real risk when we start to marry those with the test results. Over 350,000 test results, serological test results in the database as well. And that available for analysis. One of the outputs of those analyses is this particular paper published recently by Conor McAloon and colleagues from UCD. And in terms of either herd or animal level true prevalence, albeit within programme herds, so at herd level somewhere between 23 to 34%, and at animal level 3.2%. So the pilot program has been running for the past 3 years. The question is what next? And certainly at the last meeting of the UNI's implementation group, there was very clear, I think, understanding and mandate to move the program forward from a pilot phase to a formal program in 2017. And there's been significant work going on then to inform that decision, and there will be further significant work indeed in the coming months then to give shape to that. Important elements of cost-benefit analysis and looking at an appropriate model for cost sharing within that program. We have already delivered a fairly in-depth survey to participating farmers to get their feedback and lessons learned. We're currently in the process of conducting a parallel survey then for participating practitioners to get feedback from their particular perspective. And again, with a view to ploughing that back into the programme, in particular as we move to a compulsory, or not a compulsory phase, but a formal voluntary programme next year. The other area which we would seek to develop for 2017 also, just to note then, is the development of a parallel beef programme with the pilot, as I've said, to date concentrating on dairy production. Our next programme is referred to as Beef Health Check. This is a new programme which was initiated last year and really has been rolled out this year. The two objectives: firstly, using abattoir data, capturing abattoir data, to use that really to assist with management of fluke in particular, but also pneumonia. So capturing liver and lung lesions at abattoir and using that then to drive improvement, so to mitigate as far as possible the avoidable losses that accrue due to those two conditions. And then again, due to the linkage that we have with the ICBF database, that information will also be available to and will be used by ICBF to incorporate into their economic breeding indices. So rather than focusing or consisting entirely of production-based traits, to also include health and disease traits within those indices as well. So the way that this particular program is working is the capture of liver and lung lesions using touchscreen technology in the abattoirs. Our goal by the end of this year, and we're making good progress toward that, is to have a coverage of 75% of the national kill coming to the program. We're aware as well that there is a broader context with the Department of Agriculture, a wider AM, PM, antemortem, postmortem inspection system further down the line, and we are working closely with them to ensure good synchronization with that. Earlier this year, the programme manager responsible for Beef Health Check was involved in a fairly intensive round of training of the temporary veterinary inspectors who conduct the meat inspection. And as they have gone through training, then the programme has gone live in those plants. And at this stage, each batch of animals that goes through those factories generates what we refer to as a batch level report. So that's illustrated here. That goes out with the remittance, with the payment from the factory to the farmer, and provides for that particular batch of animals a detailed breakdown of the scores. The next phase, which is coming close to completion now, is putting in place not only the mechanisms for transferring that information essentially on a real-time basis to the ICBF database, but also to start to build the dashboards, so farmer dashboards, so that rather than just getting paper information at batch level, that this becomes aggregated to herd level, and over time then will be available to look at trends year on year. And from the Animal Health Ireland perspective, will allow us to build information at a national level to look at disease trends, benchmarking, mapping, and also economics. Again, going back to that and being able to identify or to seek to quantify the losses that are attributable to these particular conditions, and to use that as a further metric to drive improvement. And finally, IBR. So the objective, as stated in the strategic plan for IBRs, is eradication, consistent now with a number of other countries in Europe which have either achieved eradication or have formally approved and recognised control and eradication programmes in place. Subject, following perhaps the precedent with BVD, the important caveat that is that any decision that will be taken on moving to a formal IBR eradication programme will be predicated firstly on a positive cost-benefit analysis for the programme, and also post the cost-benefit then extensive consultation with our stakeholders, and indeed more widely with industry. So clearly there is not a formal decision to progress. A number of these are underway in terms of cost benefit, but if we just go back briefly to our Foodwise 2025 and to the department's document there, you will note that they include in that an expectation that, subject to those outcomes of favourable cost benefit, the outcome of consultation process, that a programme would be in place by 2019. And certainly the technical working group, having spent considerable time developing farm level resource, the primary focus of the work activity for that particular TWG now is looking at options for control, seeking to develop options which suit the Irish context, Irish production system, but also that are compatible with the requirements to achieve, in the European context, Article 9 status for such a programme. The TWG undertook last autumn a study visit to Belgium and to the Netherlands. I think some of the folks that we visited are maybe in the audience today, but certainly that was a very useful visit, gave us a clear understanding of their programmes, allowed us to compare and contrast, and certainly has been very useful in terms of informing our own discussions within the technical working group as to the possible options and structure of an Irish programme. So just to conclude, I think it's fair to say that since AHI was established in 2009, that we have made significant progress in developing national programmes. I think also over that period that we have become recognised as a trusted source of independent and evidence-led advice, and that independence is something that we value very much. Equally, I think we ourselves as an organisation have come to recognise the importance of active collaboration, and ongoing collaboration and communication with our stakeholders, the importance of economic analysis in terms of underpinning and guiding, informing decisions about progression to programmes, and also the cost sharing within those programmes, and an ongoing and comprehensive communication strategy, both in one sense upwards to stakeholders, but also downwards to the individual farmers who are participating in our programs. And finally, I think we are now well aware of a number of both the strengths and the challenges of operating this type of industry-led model. But I think despite those, I think we have been able to demonstrate the potential for this type of model, which is built on consensus with industry to deliver real progress. So that's me about done. Thank you for your attention. I appreciate I've covered a lot of information at a relatively superficial level there. We're happy to talk afterwards. Come to our stand in the exhibition hall, or in particular, I would refer you to our website where there's a wealth of information available. So thank you.
Thanks very much, David, and you're not off the hook yet. You've got finished exactly on time, so we've got time for 5 minutes questions. So if you want to ask a question, could you step forward to the mic and can you state who you are and where you're from? One of the questions that occurs to me when we've been watching the development of Animal Health Ireland with envy, and I wondered if you could just outline the cost sharing with a little bit more detail.
Yes, so I guess cost sharing in terms of funding of the organisation?
Certainly.
Yeah. So in terms of our funding, currently this year we have a budget in the region of 1.6 million euro. And essentially our funding model is one of cost sharing, but we are primarily funded by industry, by a range of stakeholders across the dairy processors, the meat processing sector through Meat Industry Ireland, the veterinary organisations, farm organisations, and a range of other service providers as well. But complementing that income, but dependent upon it then, is match contribution to a certain level, approximately 50%, but match contribution from the Department of Agriculture. But the important point I think to make on that funding is that is dependent on our stakeholders, I suppose, being continuing to be impressed and encouraged by the programs that we're delivering, because if they cease their funding, then we do not get the match funding from government.
But there's been no issues with that so far. That's all working.
No, we would like to think that thus far our stakeholders are happy with the progress, and that again is part of the ongoing communication.
And the further point that I would be interested in when we're looking to develop programs like that, you based what you were doing very much on Animal Health Australia model. What would you say were the major challenges in putting the whole program together?
Yeah, that's a good question, and it's probably, to be honest, it's better directed to. I joined the organisation in 2011. I think there was a lot of work done underground, as it were, prior to 2009. But really, I think one of the key drivers was a recognition that Ireland, as a relatively small country, not a relatively small country, a small country dependent on exports, needs to be positioning itself well in terms of animal health. And I think that was a key driver, a key message. But individuals who are well connected within the industry, continuing again to reinforce that consistent message. Buy-in, support from government, I think, is essential. So I think in Ireland, our Department of Agriculture has a clear vision, I think, as exemplified by those two strategic policy documents, laying out a clear vision, and they recognise the importance and the need to address animal health in that context.
Okay. Are there any more questions for David? Well, if we could just thank you again. Thanks very much, David.
Thank you, George.